I hate patients. They are so annoying. Medicine is better off without them. Used to be. I learned medicine. I fought disease, knowing it was an imperfect art, but somebody had to do it. Now, because of patience, I'm asked to apply sensitivity skills, communication skills, listening skills, informed consent skills, obligatory quality assurance checklists, empathy skills, gender sensitivity training, crisis management classes, nurse appreciation strategies, Medicare billing codes, risk management protocols, market research approaches, consumer satisfaction questionnaires, and time management and business practice efficiency. In the old days, nurses took care of all this. And that is the way it should stay. I remember the old days. That's when on Valentine's Day, someone hoisted a banner over the staff entrance to our teaching hospital which said, "Herein the young who are fucking take care of the old who are dying." That about said it all. They've made several television series about that. What happens now is that I try never to tell anybody I'm a doctor. I go to a social dinner and I'm asked what I do, and I say I'm a doctor. There is this stunned silence for a few moments. Then you hear the scratching of forks against plates. And then someone inevitably says, "Oh, you're a doctor." My grandmother was rushed to the hospital last July, which what turned out to be a hangnail, and they killed her and left some garden tool inside. And all of this as I'm trying to have my first sips of Chardonnay. I saw a patient yesterday, the last of 60 during the day. All treated under the constraints of a capitation limit enforced by the Health Maintenance Corporation and the forever shrinking Medicare payment schedules. I do what I'm asked. I schedule 3 patients at the same time every 15 minutes, starting at 7:30 in the morning. Now, the receptionist doesn't actually open the door until 7:30, and then goes to her intake window to sign in the patients. So the first 3 patients are already 15 minutes late. I don't care. I show up at 8:30. So by that time, I'm already 15 patients behind. I hope that lets them know how in demand I am. As the morning progresses, it gets worse and worse, because some old lady wants to tell me the story of her trip to the grocery store and how she dropped her change as she got on the bus, when I'm asking her if she has had any more chest pain, and I cannot shut her up. The next patient needs to go to the bathroom just as my nurse wants to put him in a cubicle. So far as I'm concerned, if you get out of queue for the bathroom, you should start all over again at the back of the line. Pretty soon, there's a surly bunch of people in my waiting room, and strung out over 4 to 6 examining rooms, reading, as you all know, out-of-date magazines. Now, if we didn't put those out and leave current magazines there, all of those up-to-date magazines would be squired out of the office in those oversized handbags ladies carry. Did you ever notice that female patients over the age of 45 always, I mean always, are twisting a rolled-up piece of Kleenex or toilet paper in their hands when they're talking to me? I don't know why they do this. I guess they're expecting to hear bad news any minute. And frankly, whenever I see that, especially if it is an elderly lady and her almost as old daughter, both carrying balled up Kleenex in their hand and twisting it, I look through their chart for any bad news I can give them. so much nicer to practice without them. In any story a patient tells, they are always being rushed to the emergency room. They never walk or drive to the emergency room like normal people. They're always rushing. This is odd to me because of the thousands of people I've seen in emergency rooms, only a few tiny percentage actually need to be rushed. The rest, once they arrive there, have already stopped off in McDonald's or Papa Gino's, knowing that they're going to have to wait hours just to be noticed by the intake clerk. So what's the goddamn rush? The overwhelming majority of them don't need to be there in the first place. So, my advice to all of you, stop rushing. We are not anxiously waiting for you to arrive. Did it ever occur to you why patients are called patients? And besides, we're just practicing.